Hello and welcome back to the American Academy of Research and Academics podcast, fostering a critical approach to medical literature. I'm your host, Maria, and today, we're diving into the practice of journal clubs and critical appraisal. For IMGs, developing the skill to critically evaluate research papers is not just essential for evidence-based medicine, but also for identifying research gaps and generating your own study ideas. This is how you move from simply reading papers to truly understanding and questioning them. Let's learn to dissect medical evidence like an expert. What are journal clubs and critical appraisal, and why are they key? A journal club is a regular meeting where a group of individuals, often residents, fellows, or faculty, discuss and critically evaluate recent scientific articles. Critical appraisal is the process of systematically examining research to assess its validity, results, and relevance. It involves asking key questions about study design. Is it appropriate for the research question? E.g., randomized, observational. Methodology. Was the study conducted rigorously to minimize bias? E.g., blinding, sample size, statistical analysis. Results. Are the findings statistically and clinically significant? Conclusions. Are the conclusions supported by the data, and are they generalizable? In an age of information overload, these skills are crucial. They allow you to sift through vast amounts of literature, identify high-quality evidence, and apply it judiciously to patient care. For medical professionals, it's about becoming a discerning consumer of scientific knowledge. Critical appraisal's edge in the residency match. For IMGs, actively participating in journal clubs and demonstrating critical appraisal skills offers a distinct advantage in the U.S. Residency match. It showcases your commitment to evidence-based medicine and continuous learning. It highlights your analytical and critical thinking abilities, showing you can evaluate complex scientific information. It demonstrates your engagement with U.S. academic culture, as journal clubs are a common feature of residency programs. Being able to intelligently discuss a research paper during an interview proves you're not just memorizing facts, but that you understand the process of generating and evaluating medical evidence. This is a highly valued intellectual skill that impresses program directors. Sustaining excellence, critical appraisal for fellowship and beyond. The ability to critically appraise literature is a foundational skill that only grows in importance as you progress. Fellowship success. In competitive fellowships, you'll be expected to understand and apply cutting-edge research to your subspecialty. Clinical practice guidelines. You'll contribute to or evaluate clinical guidelines, which are built on appraised evidence. Research idea generation. By critically identifying gaps or flaws in existing research, you can formulate your own novel and impactful research questions. Teaching and mentorship. As an attending, you'll teach residents and students how to appraise literature, leading by example. This skill is essential for lifelong learning, ensuring you stay current with the latest advancements and practice medicine based on the best available evidence. The discerning clinician, impact on daily practice. Beyond academic settings, critical appraisal profoundly shapes your daily clinical practice. You make more informed clinical decisions, choosing treatments based on robust evidence rather than anecdote or outdated practices. You can counsel patients more effectively, explaining the strength of evidence behind different diagnostic tests or therapies. You become better at identifying and addressing biases in your own thinking and in the information presented to you. Developing a critical eye for research allows you to filter the noise, focus on what truly matters, and provide care that is both innovative and evidence-based. It makes you a more discerning, intelligent, and ultimately, a safer physician. Getting started, your pathway to critical appraisal mastery. So, how do you develop and master critical appraisal skills? Learn the basics of study design and statistics. You don't need to be a statistician, but understanding core concepts like p-values, confidence intervals, bias, and confounding is essential. Use critical appraisal tools/checklists. Familiarize yourself with tools like CASP, Critical Appraisal Skills Program, checklists, or the grade system, which provide structured questions to evaluate studies. Actively participate in journal clubs. Seek out opportunities to join journal clubs in your clinical rotations or online. Be prepared to lead discussions and ask challenging questions. Read widely and skeptically, don't just read the abstract and conclusion. Dig into the methods and results sections. Seek mentorship. Work with mentors who are adept at critical appraisal. They can guide you through evaluating complex papers and help you identify subtleties. Organizations like the American Academy of Research and Academics offer structured programs in critical appraisal. Practice, practice, practice. The more papers you appraise, the more intuitive the process becomes. Critical appraisal is a skill that distinguishes a passive reader from an engaged scholar. In summary, for medical students and IMGs, developing strong journal club and critical appraisal skills is foundational for both your U.S. residency application and your entire medical career. It demonstrates intellectual curiosity, commitment to evidence, and the ability to navigate the vast and ever-evolving medical literature. If you're ready to sharpen your research evaluation skills and become a true master of medical evidence, visit https://www.google.com/search?. q=eracademics.com. Discover our tailored programs that focus on critical appraisal and effective journal club participation. Connect with us on LinkedIn or Instagram, and let's help you read between the lines of medical research. Until next time, and you've been listening to the American Academy of Research and Academics podcast. Appraise critically. Practice wisely. See you in the next episode.